Alright, so what's up you guys? In this video, this patient has a large granuloma. You can see the ingrown toenail causing it. So let's watch how we remove it. So first we're going to give an injection to numb the toe. You can see the needle is very flexible. It bends around the tendinous and bony structures so that we can get all the anesthetic agent in to numb the toe. We're using two agents. It's lidocaine and marcaine. One is a short-acting anesthetic agent. The other is a long-acting. It'll last for around 6 to 8 hours, and we are blocking all 4 nerves of the toe. And after our injection is done, we put a tourniquet on that controls some of the blood flow while we're doing the procedure. That large area of tissue there is the granuloma, and that just forms from the ingrown toenail causing increased pressure to the skin, which makes the inflammatory response build up a large mass of tissue. You can see we're pushing it away, and the toenail has a toenail spike on it, and you're going to see here as we push away this tissue, you'll see that spike, and that's what's causing the toenail. And a lot of times what happens is the patient tries to cut their nail. They don't cut enough of it. They pull with their nail nippers or their clippers, and then they create a spike. So watch as we remove and push away some of the granuloma. You should be able to see the spike here. So it's very difficult. You'll get a lot of bleeding with this. So going to make a small cut in the nail, and after that cut's made, we're going to use a small blade. You can see that's a 62 blade. If you've ever seen me do these videos on YouTube before, that's the standard 62 blade. It's a chisel blade that'll cut all the way back under the cuticle area. We get all the way under what's called the eponychium. Now the toenail is loose, so that corner has been cut the whole way. Now we're going in with a pair of hemostats. And watch as we get this out, you're going to see that spike that was creating the ingrown toenail. And then that whole large portion of toenail is what's causing the inflammatory changes of the skin building up that granuloma. And we're going to need to remove this granuloma to let this whole process calm down. And how do we do that? We just simply excise it. So we're using these tissue nippers or nail nippers, and we're cutting away that inflammatory tissue. And that's it right there. So then we'll have some bleeding. We're going to go back and excise any redundant skin or extra granuloma that has formed there. We want it to make it look nice and flat, so there's no large pocket. There's no large mass of tissue there. I was going to say pocket, so now there is a small pocket that's created where that nail was removed, and we will go in with a curette. We'll push some gauze in there that controls the bleeding, cleans it out a little bit. So all the bleeding has now stopped. The venous blood, or the blood from the veins, has drained out, which is what the tourniquet does. And again, we're just removing any fatty tissue or subcutaneous tissue that has built up in this area. Just inspecting to make sure we've got it all. Any loose skin we want to remove so that it doesn't collect bacteria or the patient doesn't pull it. Put a little bit of Neosporin on. If you're treating these yourself at home, you don't need that much Neosporin. Some gauze goes on. We'll put a little bit of a pressure dressing on to kind of control that bleeding, because this bandage is going to stay on for 24 hours, and then the patient starts soaking it in warm water and Epsom salts. So we're putting some pressure with our fingers on the gauze. We roll the gauze roll around. I'll build that up a few times, adding just some mild pressure. And then once that's done, we don't use tape. We use a product called Coban, which is a stretchy-like tape that sticks to itself. And with that Coban, we can put a little bit more compression on there to control that bleeding when the patient puts their shoe on, or sometimes we'll give them a surgical shoe if they can't fit the large bandage into their regular shoe. All right, that's it. I hope you guys like this video. Please make sure to like and subscribe and turn that notification on, because I'm releasing a lot of videos. They're coming out weekly. We are releasing shorts daily. You might want to click on some of these videos I have posted here, and we will see you soon for the next one.